Today, I will tell you about diabetic reversal in 6 months through non-aerobics, non-weight bearing exercise. And in this video, I will tell you about biological reaction, how diabetes happens, how it can overcome by non-aerobics, non-weight bearing exercise. And please watch this video carefully. Okay. First, I will tell you how diabetes happens, okay? Particularly biological response. Diabetes, the two, especially type 2 diabetes, happens because of insulin resistance. Here, I will tell you the simple biological chain reaction, okay? First, you think this, carefully watch. Eating food, especially carbohydrate, that increases blood sugar level, that raises blood sugar, okay? Then pancreas release insulin. Insulin helps absorb sugar into cells. So because of the blood sugar level rises, because of eating carbohydrates, pancreas releases insulin to help cells absorb sugar. Over time, what happens with too much sugar and fat intake and inactivity, cells stop responding to insulin properly. So when the cells stop responding to insulin properly, this is called insulin resistance. You understand now? Where cells stop responding insulin properly, because insulin is the one who takes the sugar into the cells, okay? So pancreas works more harder to the sugar which is in the bloodstream. So pancreas produce even more insulin. Because pancreas produce more insulin, pancreas gets tired. So pancreas cannot make enough insulin, so that what happens, blood sugar stays too high and diabetes symptoms starts, okay? In this, I want to tell you some key point. High blood sugar itself damages blood vessels, nerves, kidneys, eyes and other tissues over time, okay? So next I come reversal of diabetes, okay? Reversal of diabetes happens, usually reversal of diabetes, doctor suggests aerobics exercises, but here you carefully watch, it is non-aerobics, non-weight bearing exercise, reversing diabetes without aerobics or without weight bearing exercises. Reversing diabetes through non-weight bearing, non-aerobics exercises. Normally, doctors suggest aerobic exercise like jogging, walking and weight bearing exercises like squats, because they increase insulin sensitivity. They suggest this because they increase insulin sensitivity. But here I am telling about non-aerobics, non-weight bearing exercise through that reversal of diabetes. Good news in this, it is very much possible through non-aerobics, non-weight bearing. Why I tell you later, but types of non-aerobics, non-weight bearing exercises for reversal, now I tell you. Chair yoga, for example, chair yoga and gentle pilates, isometric exercises, holding muscle tension without movement like squeezing thighs together, okay? And seated tai chi, and also breathing exercise, pranayama. Pranayama can regulate stress hormones like cortisol, which also affect blood sugar, okay? Here comes the point. Now I want to tell you why non-aerobics, non-weight bearing. Now, weight bearing exercises like jogging, running, walking, dancing, Zumba and squats, all these weight bearing and aerobics exercises increases, most of the time increases stress hormones, okay, cortisol. That's why that increasing stress hormones also increases the sugar level. That's why many people are walking, running, jogging, but sugar level not decreases. So that I choose non-aerobics, non-weight bearing exercises which can control cortisol, which can release happy hormones, which can also intake your sugar into the cells. How I will tell you now. Resistance bands, okay, seated use, sitting and using resistance bands, stretching routines, static strengthening, stretching exercises, okay. Now I want to tell you how this helps to reverse your diabetes. Muscle contraction themselves, even mild, help pull sugar out of the blood into the cells without needing insulin. This pulls the, you carefully watch, it pulls the sugar. It doesn't even need insulin to pull the sugar. It doesn't even need insulin to pull the sugar, but it can pull the sugar. So in that way, all your sugar levels are coming down. In this way, all your sugar levels are coming down. So for this, I wanted to tell you something. This only decreases your sugar level in the bloodstream, so that the pancreas doesn't work too hard to release more insulin. Okay, and now I want to tell you how these non-aerobics, non-weight bearing exercise helps to reverse diabetes. Again, I told you one point and there are few other points. They improve insulin sensitivity by calming down stress responses, lower cortisol, lower blood sugar. That is one point. Second point, they increase muscle tone. More muscle, better sugar usage, even without intense movement. So it increases the muscle tone. More muscle is equal to better sugar usage even without intense movement. Here comes the non-aerobics, non-weight bearing. This is helping without intense movements, and they enhance blood flow, important for cellular health. Increasing the blood flow is most important for cellular health. So increasing blood flow happens in this way, okay. And in this, already I told you the important thing, muscle contraction themselves, even mild, help pull sugar out of the blood into the cells without needing insulin. This is called non-insulin mediated glucose uptake, okay. This is called, carefully watch, non-insulin mediated glucose uptake, okay. No need of insulin to take glucose into the cells because of improving the blood circulation. Example, just you are sitting and doing seated leg lift, holding for 30 seconds can help lower blood sugar, okay. In this way you would have understand everything. And the third one, biology of the reversal, okay. We will see this, you carefully watch. Biology of reversal. When you do these light exercises, muscle becomes hungrier for sugar. Muscles are very hungry for sugar, ready to take all your sugar from your bloodstream. And cell starts responding better to insulin. Cells was not responding to insulin resistance happened. Here cells start responding to the insulin, okay. Pancreas doesn't have to work as hard because the blood sugar in the bloodstream are going into the muscle because of the exercise, non-aerobics, non-weight bearing exercise, which I am teaching to my patients. In 15 days I teach to head to bottom, including breathing exercise, including facial exercise. I don't leave any muscle in the body. I cover all the muscles from the frontalis, corrugator supercilii, orbicularis oculi upper, orbicularis oculi lower, orbicularis oris upper, orbicularis oris lower, rhizorius, mentalis, sternocleidomastoid, trapezius, cervical muscles, and pectorals, and biceps, triceps, deltoid, and brachioradialis and forearm muscles and abdominal muscles and lumbosacral muscles and gluteal muscles, even pelvic floor muscles, quadriceps, hamstring, calf muscles, all these from the head to toes I cover, and breathing exercise to increase lung volume, to send residual volume, to increase tidal volume, and to have overall health, to peace of mind. All this will happen, and your skin glow, your body, it controls 100 diseases, not only diabetes. Okay, so I am teaching that. So in that way, in 15 days I am teaching take home exercise 2 hours. They should do it for 6 months. In 6 months reversal of diabetes will happen fine, in a finer way. Also I suggest the food and mental health also very important. But with lot of love, with lot of happiness, you should lead your life. That only will help you to overcome diabetes very well. This exercise can help you suddenly, immediately, nicely. But maintaining your sugar level, you should change your lifestyle, stress-free life, very cool life. Okay, you should do fun, you should travel, you should have friends, girlfriends, boyfriends. You should activate your hormones every day. What are the hormones you should activate? Testosterone, estrogen, progesterone, male and female hormone, and leptin, ghrelin, and insulin. All these hormones are activating through your lifestyle. Okay, and also thyroid hormone, also growth hormone, pituitary. Also you have to activate all the hormones. Okay, hormones are activating only through love, through romance, through relationship, and through happiness, through helping others, through unconditional love. In this way happiness comes, and in this way the all our hormones are getting activated, and including insulin, and also happy hormones increases, dopamine, serotonin, oxytocin, and endorphin. These all increases. Also our weight controlling hormone leptin, this properly works. Our hungry hormone ghrelin, this properly works. All these together relieves all your diseases. Okay, you have to know this. I will teach you very properly. Wherever you are in the world, you can take online. Okay, no need to worry. From your home, from your convenient time, we are available. We have a team. We are available all the time. Male and female physiotherapists are working. Wherever you are in the world, take the treatment, take the exercise, know the exercise, follow the lifestyle, go and do. Also diet, fruits and vegetables. You must take 3 to 7 fruits and vegetables a day. That will help you to overcome everything. Okay, I will teach you that. And then finally, I want to tell you biology of the reversal. When you do this light exercise, as already I told, muscle becomes hungrier and cell starts responding better. Pancreas doesn't have to work as hard. Blood sugar normalize over time. Here the important point, watch carefully. Blood sugar normalizes over the time. Then your diabetic reversal. Fat stored around organs. Okay, fat stored around organs, especially liver, pancreas, starts reducing. This fat is a huge cause for insulin resistance. So all the fat are reducing through non-aerobics, non-weight bearing exercises. So around the organs, particularly liver and pancreas, so this starts reducing through exercise. So reversal happens. If it is combined with a low carb, high fiber diet, which is fruits and vegetables. Okay, if you are meat lover, then meat, mutton, this chicken, and also fish, all these you can consume in a normal level. So high fiber diet and low carbohydrate, this will help you. And regular fasting windows also can help you, like 12 to 16 hours without food. Regular fasting windows, intermittent fasting, like 12 to 16 hours fasting you can have. That also will absorb your sugar in the bloodstream. And stress reducing, deep breathing and meditation, that I will teach you. Stress reducing, breathing, these all secondary. You just love You just, if you are a male, talk to female. If you are a female, talk to male. You just love all. That love you start and end up with the unconditional love, helping others and taking care of the animals, a dog and cat, and taking care of the animals, taking care of the nature, taking care of the old people, geriatric, taking care of the young children. This also a love, but this love comes when you let flow the love from the young children, from the school, college, everywhere. That love we should not stop. If we stop that love, hormonal love, they will never get this unconditional love. First experience that love, through that particular person should filled with love, filled with happiness. He should do romance, he should have friends, boyfriends, girlfriends, he should have marriage, everything he should have normally. Then only he can come to unconditional love. It is not directly flying to unconditional love. If you are teaching in the book, go and help others, go and do this, go and do that, and stopping the love which is coming through hormone, nothing will happen. They cannot love others. You let them to have the love which they have, they will be filled with the love. Once they will come to this love, unconditional love, which is like helping others, helping the poor, helping the society, helping the nature, helping for world peace. They will be in the peace. So their nation will be in the peace, world will be in the peace. So let the love flow, let the hormones activate, and don't worry, don't listen to anyone that who is stopping your love. Okay, whoever they are, you just enjoy your life. In this way you can come reversal of diabetes. Follow me for health tips, call me for physiotherapy consultation. Physiotherapists call me for nice opportunities. This is Prakash Physiotherapist.